got that
Sweet.
running over here.
All right.
I'm gonna start by saying, unfortunately, the report is not ready for what we sent out. I anticipated it would be ready today. My nurse checked the portal. It says it is in process, so she's trying to find out whether we're gonna have something this week. And I'm just gonna have to call you as soon as I get that.
Okay.
I did see that you had seen Dr. Hashmi.
Monday
okay.
week, I think.
Okay.
Was it last Monday? Yeah.
Do you feel like you're still breathing okay? Have you had any feeling like that fluid is building back up?
I know it's building up, but you know, I do all the things to, like, I like to sleep on my sides, but I don't do that, and I kind of sleep with, because I'm paranoid.
Okay, so you're trying to limit any symptoms.
And I'm still working at the doctor's office, but you know, if I are at home, if I walk and talk, then I catch myself a little breathing.
Okay.
Yeah.
Okay.
But other than that, as far
Okay.
as gurgling or anything like it did when I first had it in January, it was August the 22nd. But anyway, I'm tolerating it because I don't want to go with that little patch thing.
Like the drain.
I want to, Dr. Hashmi said, you know, we could drain it again if it needed to be.
Yeah.
But I don't know, I'm not at the, if we start some kind of treatment, would that subside though?
I mean, that would be the goal, of course, is that it
mhm.
starts decreasing that fluid, but
Mhm.
you know, how fast that would happen is hard to say.
So,
Or have you had a follow-up chest x-ray or anything since surgery to check? Yeah.
Dr. Strasberg, didn't I get some things over there? I got I've had so many chest x-rays. Maybe a month ago now.
Okay.
So it's been a little longer. They were doing 1 or 2 a week on me.
Okay.
Yeah.
Okay.
At one time.
All right. So let me listen to you and just see if it sounds like there's very much.
Because I'm not anxious to do anything if I don't have to.
Okay. I understand. All right. Deep in and out. Well, there's a definite difference, but
As in worse?
well, I mean, I can definitely hear that there's fluid on the right side and not on the left side.
Okay.
Yeah. Any
And my
stomach?
body tells me that, you
Yeah,
know.
okay. Any stomach pain?
Sometimes you feel like little Pac-Man are running around
Okay.
under your skin.
Okay.
But Dr. Hashmi said that on a visit that I had last week, that cancer, it has a lot of little nerves to it, and it just
Yes.
thousands, he said, really.
Yes,
So,
absolutely.
yeah, so something like that.
All right, so the two things I would say is, number one, well, just as soon as I've got this report, hopefully it gives me a direction, I will call you and say, this is what we're seeing as far as most likely cancer type, and then I can lay out, you know, what I would recommend as far as treatment and make a plan for that. And number two is just kind of watch that breathing. So if you start noticing it's really getting worse, it's limiting your normal sort of getting around, then we need to do an x-ray and see if it needs to be drained again.
Okay. I'm a tough cookie. Do you think I'm pushing it to the point that I might need to have that checked?
Well, we could go ahead and, I mean, it doesn't hurt to look, and then, you know, so we could send you, you know, over and do a chest x-ray today, actually, if you want to do it while you're here.
Yeah. I mean, you know, because I just kind of was detaining that thought to be able to find out, and we'd start a program, and I was, just like I said, I was thinking maybe
so,
it
you know,
would
I'm gonna say
subside.
under best of circumstances, we're, you know, a week out from starting any sort of treatment, and if you're already having some symptoms, you know, it may be if you did a treatment in a week, it's a week or two after that before it has any sort of effect on the fluid. So it doesn't hurt to look sooner and think about draining if we need
Just
to.
the X-ray.
All right. It's been a while, I think,
Okay.
since I had that. Well, Dr. Hashmi, when he had me with the little camera thing,
Yeah.
they had that little, what was it, a tube in there, and that was draining that.
Right.
So that was like,
So before you went home from the hospital, is the
Yeah.
last time it's been looked at.
Yeah.
Okay.
I mean, it should help. so much has been going on with me, but it felt better,
Yeah.
naturally. So,
Sure.
Yeah.
But I think the natural natural process is that fluid is going to keep building up until we find something that slows it most likely. So I'm
Exactly.
not going to be surprised to see.
Yeah.
We just got to see how much it looks like.
Okay.
Okay.
Well, I can go do that.
Okay.
Want me to?
All right. Yes, I'll print out an X-ray and get it back to you. And that does not have to be scheduled ahead of time, so you can just go to radiology and have it done.
Do I get the chest X-ray here?
We can do it either at Spring Hill, or if you want to go to one of the infirmary sites, if your other
I
X-rays have been
prefer
in
here
infirmary.
since I'm down this
Okay,
way.
yeah, that's
I
fine.
mean, simpler.
Yeah.
Wouldn't you think?
Yeah. Okay. All right,
So
I'll
would
get that for you.
Well, I do it in this room. I mean,
It's
not this
actually,
room.
we'll have them show you where to go, but you actually leave our office, walk across the lobby, and there's a registration on the first floor in this same building, and then they'll take you to X-ray from there.
Okay, and then if they want to drain it, will they make a
So
choice?
if they want to drain it, I will be the one who looks at that report, and if it looks like there's enough on there that we want to think about draining it, then we'll have to set that up separately.
Okay,
So that
which
would not
a
be
few
today.
days or
Yes,
something like that.
exactly.
Okay, I got you.
Okay.
Is this to have it drained? Is she going to have to be admitted to a hot?
No, the goal would definitely be to do it all outpatient.
Oh, okay.
Yeah.
Okay.
So now I can go get the chest X-ray now. They're gonna send me wherever.
And
you
they'll
said.
give me a report on that.
And then
before the end
you'll
of the
make
day.
a decision. Well, she may need it drained, and you'll let me know.
Yes, ma'am.
I don't think that's a bad idea,
Okay.
do you?
I don't.
Yeah.
I don't think it hurts a bit to look.
Okay.
Okay. Any other
So-
questions y'all can think of? Yes.
I mean, we just seem that we've been waiting
I
so long
know.
for a
I
definitive
completely
answer.
understand.
We're getting really frustrated. I know it's not. I'm just
I'm
saying
willing
that we
to
are.
wait it out.
And so, I mean, do you anticipate that
I
those?
mean, this actual report was ordered on the 6th. So usually I get that in 2 weeks, which should be right now.
Yeah.
So, I mean, I anticipate we're gonna have it this week.
Yeah.
Because today's Wednesday, so.
And
sure,
I mean, I completely understand your frustration. I'm not trying to downplay it,
Yeah.
but I would tell you anywhere you went in the world, they want these results before they make a plan.
Right. Oh yeah.
And it's
Oh
just-
yeah. I mean
It
that.
just kind of ties our
yeah.
hands to make the best plan for you until we have all of that.
Yeah.
Since you all are affiliated with UAB, was there any kind of way you could send the results to them?
And we're not affiliated with UAB.
Oh, you're not?
No. We share patients with UAB all the time. So if we need to get a consult with them, we can.
Mhm.
But they don't look at records without
Right.
seeing the patient
Okay.
or anything like
And
that.
they're the ones that would need to see what all you've done, and
Exactly.
so you gotta
Right,
get it
yeah,
done, so
yeah.
you just be jumping the gun, so, yeah, I just wait it
Okay.
out.
Okay.
Cause we'll know something in a day or
We
so.
will.
Yeah.
Okay.
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 Yeah.
So we're going to go get X-rays now.
Correct.
Okay.
All
And we
let
know
me
where
print
to
the
go.
order. We will clarify for you for sure. All right, y'all sit tight a minute, okay?
Okay.
All right,
Thank
thank you, love.